today is part 2 of an interview that was started a couple of weeks ago between me and Amy Hollenkamp. So Amy is somebody who runs a blog called the SIBO Diaries, and I am a myofunctional therapist, and we have discovered that our paths cross quite a bit. So today's interview is going to be more me asking Amy questions versus her asking me questions. So why don't you give us some background on you, Amy, just to kind of kick things off, and then I'll just dive into my first question.
Yeah, so I started the SIBO Diaries mainly because I had SIBO and there was a lot of confusion going around about what the best treatment was and what were the root causes. So I mainly started the blog just to kind of provide some evidence-based, kind of research-based way to share kind of what I was learning and also to get some feedback from what other people were doing that was helping them. So I guess we're going to dive into like what SIBO is too. And I'm sure some of your listeners or viewers don't really know what it is. So
yeah, no, that's my first question for you. So can you just explain to us, because I'm not even 100% sure of what's the definition between, or the difference between SIBO, leaky gut, and some of these other digestive issues that we hear a lot about. But if you could just give us some definitions and exactly what it is, that would be awesome.
yeah, so SIBO is an acronym and it stands for small intestinal bacterial overgrowth. And so it's essentially when excess bacteria is sitting in the small intestine where it shouldn't be. So compared to the large intestine, we hear, probiotics, healthy bacteria being really something that promotes health. But when it kind of gets into the small intestine, it causes a lot of issues. So the small intestine is supposed to be relatively sterile compared to the large intestine. So what happens is when that bacteria gets stuck in there and it kind of ferments, like food ferments in there, causes a lot of inflammation, and it causes you to not absorb nutrients properly, because that's mainly what the small intestine is made to do. It's to digest and absorb nutrients. It's not really meant to have excess bacteria in there.
So these, sorry, I'm interrupting you. Are these like good bacteria? We hear of good bacteria versus bad bacteria. So it's an overgrowth of all bacteria, or explain that a little more.
It can be good bacteria. It can be bad bacteria. So it really does depend. So it doesn't necessarily have to be bad bacteria. It could be good bacteria too.
Oh, crazy.
Yeah. So what happens though is that once you have all that bacteria in there, it causes inflammation. It causes damage to the cells lining the GI tract, and it can cause all these malabsorption issues then as the GI tract starts to kind of degrade a little bit and it's not releasing enzymes like it should. And so then you see a lot of carbohydrate issues, not being able to absorb those. The bacteria actually can deactivate bile, which is really important in fat digestion. So a lot of people that have SIBO don't digest fat well. And even like vitamins and minerals. So bacteria, they can steal like B12, iron, certain vitamins and minerals. And so then we're not getting them and we become deficient. So a lot of SIBO patients just become deficient in a lot of these nutrients, and it becomes like this vicious cycle because they have all this inflammation going on, then they can't digest it, and then that undigested food allows that bacteria to thrive because they can feed on it.
So that's really interesting. I actually didn't know that. So I think all that is really, really good stuff. How many people, this is just kind of a random question, I don't know if you know the answer, but like how many people are affected by this, do you think? Like millions?
It's hard because a lot of people do different testing methods. So depending on the testing method, from what I've gathered, the experts say about 60% of IBS patients have SIBO.
Oh, okay. So if you have IBS, look at this stuff. Start looking at like maybe I actually have SIBO. Okay.
So kind of there's more conventional people that say it's a little less, more like 40-ish%, but I would say it's still a large number. You know, it should still be ruled out if you have IBS and have a lot of gut symptoms that you can't really figure out.
Yeah, that's good to know. So I want to ask you about your story, but why don't you tell me, first of all, how do you get tested? How do you know that you have this, since we're on that topic?
Mm-hmm. Yeah, it's kind of weird because the gold standard is they do an endoscopy, so they take like a camera and actually go down, and usually it's done for like to get H. pylori or to look at like ulcers. But you can also get cultures of the small intestine, so like literally taking a little culture and seeing if there's bacteria growing. But that's a pretty invasive thing, so it's not really used as much to test for SIBO. The main test that's used is like called a breath test, and you can use lactulose or glucose, and they're both sugars. So you drink this little solution, and then you like breathe into this bag every 15 minutes, and you basically breathe in the bag every 15 minutes for like 2 to 3 hours. And then you send those bags to the lab, and they're looking for gases. So that those bacteria in the gut, they'll produce either methane or hydrogen gas. They can produce hydrogen sulfide, but they don't actually test for that for SIBO. But you can have SIBO and have hydrogen sulfide. But so they look at these gases, and they see if you have high levels of these gases, then you're likely to have SIBO.
Wow. Very cool. I did not know you could do a breath test for that. That's awesome.
Yeah, and there are some issues with the breath test. It's not perfect. You can get like false negatives and false positives. So it's kind of like good to work with a practitioner who really can like do additional testing and also do like look at all your symptoms and really decide the best course of action. And if you have SIBO, it's kind of like a confusing thing. If you think that you have SIBO, but your breath test isn't really showing it, it can take someone with a good eye to really determine what's best.
Okay. Have you done that breath test? Have you actually taken it, or how did you?
Breath test.
Oh, okay.
Yeah, it's kind of confusing because some people want to blow, like when you, but it's like just breathing. But it's super easy. I mean, you have to prep for it. So to kind of eliminate some of the false negatives or positives, they have you on a special diet beforehand so that there's no gas formation from something else that you ate in the last like 2 or 3 days. So it's a really like low fiber diet that's going to prevent any fermentation that's not a result of those sugars.
Okay, so you've taken this test. So tell us, what's your story? Like, start from the beginning. Tell us, how did you figure out that you had SIBO? What symptoms were you having? How did you get to where you are now?
Yes. So I had GI issues start kind of when I had mono in, I think, my freshman year of college. So I was probably 19 or so. And they were manageable, but like they were kind of always there after that. But I wasn't proactive about fixing them. So it kind of like festered until it got to like a climax point where I had just started my first job as a marketing analyst out of grad school. So it was just, I think, way too much stress, and it just kind of like blew up a little bit. And I was losing all this weight. So I probably lost like 20 pounds in like a 2-month period. I was like, I don't know what's happening. I'm going to go to my doctor, like this isn't right. And so I go to my doctor, and he basically was like, well, the tests are normal. You have IBS. You know, that's the typical response that you get a lot of times from conventional doctors. And I mean, of course, I was like, well, you're just telling me what I already know. Like, my gut's irritated, from the irritable bowel. So it's kind of a junk diagnosis. It doesn't really tell you much.
So had you been researching it? Had you started to learn about this stuff on your own and then went to the doctor? Or did you go to the doctor and now, okay, I have IBS, I better look into that? Or what was your path from that after the
Yeah,
doctor appointment?
with the doctor, I was an analyst at the time, so like my whole job was to look at really complex like business problems and break them down. And so in my mind, it never really flew. Like IBS was never a good solution for me. I knew that there had to be a root because that was just like my thought process as an analyst. So I really dug into functional medicine at that point. That's kind of when I stumbled on it. I think I was just doing like web searching, you know? So I found a functional medicine doctor in my area and I went and saw him. Originally, like when I was just doing my own research, I thought I had Candida. So that's kind of like when I was kind of on my own, I was dabbling in some anti-Candida stuff. But when I went to the doctor after testing and stuff, he diagnosed me with SIBO. And that kind of gave me a place to start. But I also had made a lot of mistakes along that route too. Because with SIBO, it's a bacterial problem, but people focus so much on it being a bacterial problem when really it's a symptom of a bigger issue. Because usually it's caused by some breakdown in motility or digestion that needs to be resolved in order to clear it for good. So, like, I made a lot of mistakes not seeing that connection because you kind of get stuck in, like, well, I got to clear this bacteria out, you know, but without correcting the root cause of what's going on underneath that.
Yeah, what would a mistake be? I'm just curious because I have no idea.
Yeah, so, well, for me and for a lot of people in the SIBO world, it's over-treatment. So they'll do like and I did this too, you know, doing like an antibiotic treatment or an antimicrobial treatment to remove that bacteria. But if you overshoot it, you can cause a lot of issues. So you kind of want to kill the bacteria in the small intestine, but you don't want to shoot over too far to where you're killing too much in the large intestine to where it's creating even more issue. So I kind of took like the wrong antibiotic at first. That was like a big mistake. And then I think I did like an herbal antibiotic right before I did the pharmaceutical antibiotic. So it was just like too much all at once. And a lot of people do that because they're like, I'm still having symptoms. I'm still having symptoms. I need
And
to.
that's so crazy because I always hear antibiotics like wreck gut bacteria,
Yeah,
so we shouldn't take them because they, then everything's out of balance and, it destroys your gut. So now the treatment for this sounds like it is antibiotics, at least to some
exactly.
extent. So that's counterintuitive sounding,
It's very finicky. So, like, it's one of those things where a lot of times people don't feel better unless they clear it. Like, it's hard to clear once it's in there. So, antibiotics can be a really good option. Sometimes people might want to take a more conservative approach and try probiotics, and that has shown to be somewhat efficacious, but it kind of depends on the case. Like, some cases are going to require some sort of antibiotic treatment, but again, it's tricky because then you need to figure out, well, I'm going to take these antibiotics. I need to make sure that I'm doing everything possible to keep my large intestine healthy and strong too. And a lot of people miss that. They kind of go all into like, I need to clear this out. And then their large intestine is kind of wrecked after it. So that's kind of a big mistake I made. And then the second big mistake that a lot of people make is being too restrictive. So they'll try to starve the overgrowth. So, I'm not going to feed it any fiber to try to starve it, but it's almost impossible to starve. Like, I don't think I've ever seen someone on an overly restrictive diet and it works super well. Because it might help symptoms initially, but over the long run, it can really cause negative consequences in the large intestine because not only are you not feeding the bacteria in the small intestine, but again, you're failing to look at the whole bacterial tract. And you can also have some nutrient deficiency issues when you're eliminating a lot of these foods. So it can be confusing in that respect because a lot of people overly restrict or overly treat. I think those are the biggest issues I see.
Yeah, and that's kind of another go-to thing when you're trying to fix your digestive issues is to start trying to do these elimination diets. And usually I think that's more related to leaky gut, and to kind of troubleshooting like, the intestinal lining and stuff. Do you want to just give a quick difference or description of leaky gut and issues like that with gut permeability and stuff versus SIBO? Because they sound pretty different to me.
Yeah. So intestinal permeability basically is when you have damage along so your gut barrier is one cell thick. So it's kind of really delicate. And you have a mucosal layer that's on top that can help prevent any inflammation or bacteria from touching that lining. So a lot of times, like in the American diet, and if we're not eating enough fiber, if we're not eating enough gut healthy foods or not getting enough probiotics, we have messed up guts to begin with. We have dysbiotic guts. That mucosal lining becomes really thin, and then you get a lot of bacteria and food stuff that's hitting that lining and causing a lot of immune responses. So your immune system starts to become overactive and it starts to really break down that layer, and food and toxins and waste can start seeping from the GI tract, which is essentially like a big tube. It's funny to think about it like that, but like your GI tract is technically not inside your body. Does that make sense?
What? Oh,
It's
no,
like
I
a
see what you're
donut.
saying.
If you think of like your GI tract is like a donut. Like it might be you might think it's inside you, but technically it's not inside you until you digest and absorb it.
Ah, it's kind of like a closed system until it.
Exactly.
Yeah, okay.
So like our immune system is so prevalent through there and trying to keep pathogens out and trying to keep foreign invaders out of our body. So what happens is once that GI barrier starts breaking down, the immune system becomes overactivated and it's chronically like in a stress response and creates all this inflammation. Things start seeping out into the bloodstream and it causes things like food sensitivity, allergies. A lot of it's being linked to autoimmunity at this point. So that's kind of what leaky gut is. But it has a lot of ties to SIBO because SIBO can cause leaky gut.
Okay, interesting. Yeah, I'm learning new things, so I'm glad we're talking about this stuff
Yeah.
today. Uh, why don't you go on to kind of explain why are we starting to talk about this stuff so often? It seems like everybody has a gluten sensitivity, or everyone has leaky gut, or everyone has IBS. It's just these things are getting diagnosed and talked about so often these days. And what's your theory on why we're seeing like so much more of these type of digestive issues? Do you have any idea of why, or what's your opinion on it?
Yeah, I mean, our guts, like, I feel like aren't programmed for the 21st century at this point. Like, we are just doing so many things at this point that are sabotaging our guts. And, like we talked about, that intestinal barrier is so crucial for optimal health, for optimal immune function, for optimal digestion. And so that all starts with having a healthy microbiome, healthy gut bacteria. So they're so crucial in promoting like it's called, oh, what's the protein? They're called tight junctions between the lining or between the cells of the lining. So a lot of good bacteria promote the tight junction function. So keeps that barrier really tight and sealed really good. And so if you don't have a diverse gut microbiome, if you don't have high levels of like bifidobacterium and certain good bacteria that promote that lining, you can have issues. So I think there's so many things that we're doing that can deplete both diversity and good bacteria. And the first one is probably overuse of antibiotics. It's like all in our foods. It's in our food supply at this point. There's a time and a place for antibiotics, but
yeah, I agree. But yeah.
but like me personally, I had, when I was like 1 or something, I was put on like round after round after round, and like the microbiome basically is formed by the age of 3. So like it shifts a little bit, but you're gonna get like your microbiome's pretty much set at that point. You can do some things to shift it around, but you'll have most of the bacteria that you're living with by the age of 3. So if you think like I was 1 and having all these antibiotics thrown my way, like it could have had something with, it could have done something to lead me to where I ended up. Some other things that can really affect it is our fiber intake's a lot lower than it needs to be. So I think the average American's fiber intake is like 15 grams, and I think the recommendation is like 25 for women and 38 for men. So we're well below.
Oh, okay. Do you think 25 or 30 is ideal, or should we actually be getting more than that?
That's a tough question, because I think a lot of hunter-gatherers, they're eating like 150 grams a day. Like, it's crazy.
Whoa.
And again, like, our guts probably couldn't handle that at this point. They'd be like, whoa. But some microbiologists suggest like 50 grams, which is a lot a day. I'd say like 30 to 40 grams is probably a good amount to keep things healthy and running.
Okay, that's good to know. What do you think about, I keep hearing about GMOs and pesticides and some of these things that are in our food system affecting our gut lining and affecting our microbiome. And what's your take on that? Do you try to eat like only organic food, or do you think that matters?
I think it definitely matters. So the big one that I just like is crazy to me that it's still being used is glyphosate. I mean,
yes, I've read so much about that.
It's mind-blowing, and glyphosate is essentially a part of Roundup, right? And it's basically an antibiotic, but it's sprayed on so many of our crops. And not only is it an antibiotic, but it targets like good bacteria. So it's not like indiscriminately killing bacteria. It's targeting a lot of the good bacteria. So
good bacteria in the plants it's used on, or in our bodies, or
in our bodies.
Oh, huh.
So like it targets Bifidobacterium, which is one of the genuses of bacteria that's super important for the GI tract and super important for maintaining that good lining. So it's crazy to me that that's being used all over the place. It also inhibits some of the enzymes that are crucial for digestion. So like trypsin, it inhibits trypsin. And trypsin is what's important in digesting like wheat protein. So that could also be playing into a lot of the increases in like gluten issues and issues with wheat and things like that. And then some of the GM stuff, the GM crops where they're modifying those crops to produce insecticides, the way those insecticides are working is they're creating, poking holes in the GI tracts of the insects. So if the insects are eating these crops, they're poking holes in the GI tracts of the insects, but that's not limited to just bugs.
Oh, it's doing the same to us.
Bodies. So they've done studies, and it does similar things to human cells. So you have to think that that can create inflammation in the GI tract as well. So it's kind of crazy about all this stuff. And I think I wouldn't kill yourself about eating 100% organic, because it's so, like, the stress of that can be hard. But I think trying to eat organic when you can is important.
Yeah, I I think so too. I've been trying to do that as much as I can, but
Yeah.
sometimes it's either not an option or sometimes certain products will only say non-GMO, but they're not fully organic. So,
Yeah.
you can try your best, but I think it's at least good to be thinking about these things. I've read a lot about glyphosate, and I've even heard, and I hope this isn't right, but if maybe I'm misunderstanding it, that even sometimes organic crops can be desiccated with glyphosate. Have you heard that?
I have heard that, and I think it has to do with like the vicinity of where the crops are. So, one
Ah,
farmer next to one farmer is growing organic and is right next to a farm that's growing inorganic. So, like, how do you prevent like it from
yeah, like
being in the air?
cross-pollination. Yeah.
Yeah, so I've heard that. I also heard that like glyphosate's in our water now. So it's just
I've heard that too. It's like so
where,
depressing. I'm like,
how do we get away
what do we
from it?
do?
Yeah, but it's increased so much in like the last 20 years in terms of how agriculture is using it. So it's scary, and I don't know what the
Yeah.
solution is at this point, but
Yeah, and I know that we've talked about that product, Restore, in the past. And have you heard any of the interviews that the guy who invented it, Dr. Zach Bush, have you heard him talk about this stuff?
I have. It's really interesting. And I don't know if they've done like human studies. I know they've looked at the cells. So when they test Restore, they're looking at cells, but they haven't done it yet in humans. And maybe they have, I just haven't seen the research. But the cell research is super fascinating because it protects against glyphosate and also gluten issues. It can be really helpful for.
Oh, interesting. And I think it's actually, it works on those tight junctions you were
Mhm.
talking about, right? It
Yep.
helps those be stronger, I think.
Yeah, that's exactly how it works. But he's really cool, Zach Bush.
Yeah, he's super interesting. And
He's like triple board certified.
yeah,
Did
and
you
he's
know
been
that?
on like so many podcasts and so much stuff lately. I feel like he's just everywhere. I'm like, oh, another Zach Bush interview. And
Yeah.
I think that Restore product is, I think it's going to be very important for people to start protecting their microbiomes and their gut linings and stuff with products like that. I don't know how else we'll, get around uh, all these things, that are basically breaking down our digestive tracts.
Yeah, I know. We'll figure it out though. We got a lot of people on it at this point. So
Yeah,
I'm
good.
optimistic.
Yeah, you have to be optimistic. Otherwise, like sometimes I listen to that stuff and I just get so like, oh, we're all doomed, I get like so sad.
Aw.
Um, so what's if you actually get diagnosed with SIBO, like you're told you have it, how do you treat it? What's the cure? And I'd like to hear some of the things you've tried as well, because you seem like you've kind of got out, the light at the end of the tunnel. You've got out the other end of this whole SIBO thing. So, what in general helps people get to the point where you're at, and what did you do too?
Yeah, so the first kind of thing that I think I mentioned it before, the first thing that most people do is, they jump on an antibiotic, either herbal or pharmaceutical. So you can do both. The pharmaceutical antibiotic is actually pretty unique because it's called rifaximin, and it only works. I mean, this is what I've heard from the expert. It doesn't do very much damage to the large intestine because it's activated by and deactivated by the bile. So it pretty much just stays in the small intestine because the bile gets reabsorbed before um, anything moves to the large intestine. So it gets deactivated before the large intestine, which makes it a really cool antibiotic for SIBO.
Yeah, I didn't know they could be that specific. I didn't know
Mm-hmm.
that.
And it's not a systemic antibiotic, so it just stays in the GI tract. Whereas like some antibiotics, they're systemic, so they go into the blood.
Mm.
So that's really good. So people either jump on that or they'll do herbals. So there's been research showing that herbals can be just as effective, and they're usually more specific at killing things, like killing the bad bacteria versus the good bacteria. So people will usually go on those for like 2 weeks to like 6 weeks, depending on if they're doing the antibiotic or the herbals. Herbals are usually longer, like 4 to 6 weeks. And usually their symptoms improve. So like the main symptom of SIBO that you see is like severe bloating. So if you have severe bloating, that's from all that bacterial fermentation going on in the small intestine. So they'll see improvements in bloating, they'll see improvements in just general well-being after that antibiotic treatment. But again, unless that you address what's going on, what's the root causes, a lot of times symptoms return. So a lot of people do cyclical antibiotic treatments because they think it's just like this is just their life now, you know? Like this is just going to continue to come back and come back. I'm not a real believer in that, just because usually when people do that, it's a diminishing rate of return. So they might have had a really good first round of antibiotics, but you know, by the time they're on their fourth round, it's not effective at all. So then they're kind of like screwed because they've been relying on this. So really, it's digging to like some of the underlying motility problems that could be at play and why that bacteria is getting stuck in there. And then also looking at any breakdowns in digestion, so like low stomach acid, weird enzyme release. So, you know, if you have pancreatic problems, a lot of people with pancreatitis, they'll get SIBO. If you have like bile issues, so if your bile is not flowing properly, they can all cause SIBO. So if you have any of these underlying issues, you need to resolve them. But the biggest one is probably motility and brain.
That's what I was going to ask you about. I'm curious, like, what would an underlying motility issue be? Like, how would you get that?
Yeah. So the biggest one that is basically talked about all the time by a lot of the experts is a deficiency in something called the migrating motor complexes, which I've mentioned to you before about.
Yeah.
So essentially what this is they're like wave-like contractions that sweep the small intestines clean like between meals. So it's kind of like electrical impulses that stimulate that smooth muscle and sweep it clean in between meals. It's kind of like a broom. That's what people call it. You know, if you can imagine a broom just sweeping everything clean so that things aren't sitting there for a bacteria to ferment. So a lot of people, if you're healthy, you have those maybe every 2 hours. Things are moving through. It's detoxifying that whole small intestine. SIBO patients have a 70% reduction in that function. So they might only be having those every 6 to 8 hours, and that's kind of leaving food there to fester and creating this prime environment for bacteria to really feed on whatever they want to feed on, you know, like for bacteria to grow. And so that migrating motor complex also controls the valve in between the large and small intestine. So if that valve is not functioning right because it's not getting the right stimulation, the large intestine bacteria can then translocate into the small intestine.
Oh, yeah. And
so that MMC function is all controlled by the brain and the vagus nerve. So it kind of brings it full circle what we were talking about before, because you need that adequate vagus nerve function in order to have adequate MMC function. So like
that totally connects to, you know, the stuff that I was saying. I've been wanting to hear your side of it, because I know like my side with the nitric oxide, which stimulates the smooth muscle and helps with digestion. Now I get why that's so critical. So yeah, it is full circle. Swallowing, vagus nerve, mouth breathing, fight or flight, nitric oxide, all this stuff.
Everything's connecting. Check. Yeah, but but a lot of people have, you know, these weak vagus nerve, weak firing into the gut, or even the gut inflammation is causing that issue where they're not getting the brain to fire down to the vagus. And even in a myofunctional case, if you're breathing out of your mouth all day, if your tongue's in the wrong position, you're not getting that strong vagus nerve function that you probably need in order to have those healthy MMC cleansing waves going through your small intestine. So a lot of people with SIBO, I mean, it's been called like around 80%, that's the cause, is these deficiencies in MMC.
Interesting. Okay, that's super fascinating to me.
Yeah. So there's just a lot. To me, SIBO is primarily a brain-gut axis problem. And a lot of the focus still today, but it's shifting, is that it's a bacterial problem. So you can see how people can get stuck in the treatment phase of just removing the bacteria and not, without seeing this whole other side of what kind of things could potentially affect the brain-gut axis. And they're missing an opportunity to correct it in the long term instead of just alleviating symptoms in the short term.
Yeah, okay. Now, one of those I kind of dropped like a hint of what we'd be talking about, and I was super interested because a lot of people think it sounds so crazy to have an actual fecal transplant. So is that a way to change the bacteria? Tell us more about that. And I know you have a whole story around this, so why don't we go into that and kind of talk about how that is something that for some people it's an effective, I guess, treatment or cure, right?
Yeah. So I think for me, by the time I was considering FMT, I had cleared my SIBO. So that's another important factor, because I think if you want to look at FMT, it's helpful that you've already cleared the overgrowth and you have some function, because you could put new bacteria in, but if the overgrowth's still there, it might not work as effectively. You know what I mean?
Yeah, okay, that makes sense. Yeah. Or if you don't change your diet or if you don't go through any of those other steps,
Exactly.
it's probably
And
kind of a
so,
waste.
yeah, and so the people at the FMT clinic usually recommend, if you have SIBO, to do antibiotic treatment before to clear things out. But luckily for me, I didn't have an active overgrowth at that time. So I had chosen to do FMT because, first off, I had done a lot of treatments on my gut in terms of antibiotics that I was like having trouble regaining anything. So like I tried a ton of stuff, tried increasing this or increasing that, and nothing was really sticking. So I was still doing gut tests and finding a lot of overgrowth, opportunistic pathogens, things like that in my gut that I couldn't just get a handle on. So I was like, I'm just going to do this and be done with it. And so I decided on a clinic that's based out of London, but they have a branch in the Bahamas. So I went to the Bahamas for 2 weeks, and every day you got a new treatment of the transplant or whatever. It's like considered an implant. It was super simple, super easy. You have a little bit of weird symptoms afterward. Like I had horrible nightmares. Like it's
Oh,
weird. Yeah, you
that's
have
weird.
weird symptoms, man. But luckily, a lot of my gut symptoms started to resolve after that. And in particular for SIBO, there's a lot of links between the bacteria in the large intestine and that migrating motor complex activity, so that cleansing wave. So when they've looked at animals, like good bacteria promote that, whereas like some of the more iffy bacteria inhibit that. So you really need like a good large intestinal bacterial population to facilitate that, because that bacterial community communicates back through the vagus nerve. Like it's such a dynamic process, and that's how it can stimulate the MMC. So you can't just look at SIBO in isolation as a small intestine issue and not consider the large intestine as
Or the
a way,
brain.
as a way to facilitate that migrating motor complex. So I think for a lot of people with SIBO, it can really deal with any sort of large intestinal imbalances that could be preventing you from getting better. But in terms of other GI issues, they have a lot of success with IBS, and some of that can be SIBO related that they might not be treating. So I know the clinic microbiologist said they have a lot of success with IBS. For things like Crohn's and ulcerative colitis, it can be a little hit or miss because it upregulates the immune system, and so it can cause flares if you're not careful.
Okay.
So you have to
Now,
be a little bit more careful with like autoimmune conditions of the gut that are really inflammatory.
I'm curious
Um,
because you said you have your microbiome. It's basically developed by the time you're 3 or when you're a baby. So is this actually changing? I mean, this is external good bacteria that goes into your gut. And so maybe this is actually a way to truly change it as an adult.
yeah, and I think, and we haven't really gotten to probiotics too, but a lot of probiotics, they aren't even really making it down to the GI tract.
I've
So,
heard that.
really?
Mm-hmm.
So you have to be careful because even the popular ones, they get killed by the stomach acid. So, they do studies and like 99% of what the certain really popular probiotics are being killed in the stomach. And there's some research that's showing even dead bacteria can be helpful in some way, like with
Oh,
the
wow.
immune system. So maybe it still has some benefits, but it's not doing anything to really repopulating, So it's really about choosing the right probiotic in that case. I love more spore-based probiotics. They can survive the GI transit. Megaspore Biotic, I don't know if you've heard of that one.
No, I haven't, but I'll look it up.
Yeah, that one is literally the best probiotic I've ever tried.
Okay.
So I was struggling to gain weight. This was even before I went to get my FMT, and that probiotic helped me gain weight, which was like super important.
Okay. Now
Um,
I've been reading there's probiotics that are like a billion, they give you like a high number of bacteria, but they're not necessarily like many different strains. It's maybe only one or two strains. Like, do you
yeah,
think talk about the difference between that and if that's effective or not, or good or bad, or what do you
yeah.
think?
I think with probiotics, it's always important to have diversity because I think your overall goal is you want the gut to be more diverse. So if you were going to do um, that kind of high dose, but one strain, I would try to rotate different strains if you could. So if you were doing that for like maybe 4 weeks or something, rotate to a different probiotic. Even if you're on probiotics in general, it's a good idea to rotate them just to get a little bit
Okay.
more diversity. And probiotics are weird too because especially if someone has an intestinal infection or an overgrowth like SIBO, they might react horribly to a probiotic.
Mm.
And so it's kind of important to realize like every microbiome is different and might need different strains. So it's kind of like probiotics are weird about you kind of need to experiment a little bit. And with SIBO, especially, some people just cannot handle probiotics at all. So, and that can be a timing issue too. So maybe the overgrowth is too great right now, the bacterial load's too high, and it's just too much for their system to handle. Some people too react to lactic acid producing bacteria because they react to something called D-lactate. So like some people can't tolerate Lactobacillus acidophilus, which is in like so many probiotics. So it's kind of an important one to consider. Some people react to the prebiotics in the probiotic, especially SIBO people. If it's triggering them in some way. Trying to think
So
of.
it sounds like it's good, to look at this stuff and to read about it, but you might actually get to the point where you need to like work with a functional medicine doctor or
Exactly.
find a professional to help you. I
100%.
Yeah, I
Mhm.
get that.
Yeah, I think it's SIBO, especially, really any gut health problem is going to have complex underlying root causes. And it really takes someone looking at your individual case and your presentation and what symptoms are really important for you to resolve right now um, to get a good idea of what the best options for treatment are. Really, just trying to wing it is never a good idea. And I have been there and have had very bad experiences when I've done it. So,
Well, it's good to know. I mean, I feel
yes.
like that a lot with the therapy that I do, like there's a lot of stuff online, there's a lot of exercises you can do by yourself, but sometimes people get to the point where they actually just need a therapist to give them like a tailored, individualized program that's meant for them specifically, and not just like, here's a bunch of random information, because it's out there, but sometimes you need more, right?
That is so true.
So one thing you mentioned a while back, and I didn't actually have a good way to intertwine it into the mix with questions, is about Candida. So you said that at first you thought you had a Candida overgrowth. What's the connection between Candida and SIBO? And I know that Candida is like a huge topic, and so many people are concerned with it. So that's why I want you to go into that a little more.
Yeah, so Candida is a yeast, and there is limited studies on the intestinal, like it being an intestinal infection, but there are some which are very interesting, especially with SIBO. So there was one study, I actually have, let me pull up my notes from that because there's specific numbers. But so this study looked at like 124 participants were in the study, and it was the participants had unexplained GI issues. So, they didn't have celiac, they didn't have Crohn's, like what was going on? Well, 62% of them had either a SIBO overgrowth or a fungal overgrowth, so a Candida overgrowth in the small intestines. Or fungal overgrowth. It didn't necessarily have to be Candida, but some sort of fungal overgrowth. It could be Candida. So, of those overgrowths, so 43% or 34% had both SIBO and SIFO. So they had both the fungus and the bacteria. 40% had SIBO alone, and 26% had just the fungal overgrowth. So basically what this is saying is that most of them had very similar symptoms. So it's hard to differentiate between what is SIBO, what is Candida in the small intestines, or what is both.
Okay. So they can mimic, like the Candida overgrowth can look like a bacterial overgrowth.
Exactly right. So true. And so it can be hard if you're someone who's trying to treat it based on symptoms, because let's say you have Candida, but you think you have SIBO. So you take an antibiotic.
It kills all your bacteria.
Yeah, it kills all the bacteria and lets the fungus grow. So I think doing things like stool testing, and there's something called organic acid testing that looks at some of the organic acids that a fungus would produce. Usually it's in the urine. And it can tell you, they basically can indicate if you have fungal issues. And I think it's always good to rule out if you're going to treat SIBO.
Yeah, sounds like it.
So, and then also the stool test can provide you with some good information about SIBO as well, or like how your GI tract's running, just in general.
Well, I'm hoping that you can give us some good. I'll put links in the notes below the video, and if you can give us some places to start looking at this stuff. If you're thinking, oh, maybe I should look into this for myself, then what are some tests, or what are some good places to start? That would, I think, be really helpful.
Yeah, I can definitely do that. I think in terms of a stool test, I love the GI map, and you can order that on your own without your doctor, but I think it can be covered by insurance. So asking your doctor about it, if possible, I would definitely try that first. And then the breath test you can also order online too if you can't get your doctor to run it, but if you have a GI doctor, which some people don't, but if you do, ask your GI doctor about doing some sort of breath test, because they do it in the conventional world, just not really super frequently. You'd probably have to ask for it. And then I can add a couple other tests that might be good. Even looking at some nutrient deficiencies can be helpful, because like B12 issues are a huge one. Iron is a huge one that's often seen.
And
Another
that's just from not being absorbed through having your digestive tract like not working the right way,
exactly.
basically.
Exactly. And hypothyroidism is another really big one that's connected to SIBO. So like 54% of people with hypothyroidism have SIBO.
That's interesting. Explain the connection. I'm just curious. Like I can't make the
Yeah.
connection yet, but say it and I'll
So
get it.
again, it's a delay in motility. So thyroid hormones are really crucial in the rate of transit through the GI tract. So again, it's like food is being delayed in the small intestine again. And
Oh, okay. Okay.
right for an overgrowth. Yeah.
All right. Well, I mean, that's basically everything that I wanted to ask you, but can you think of anything else that I missed or that you'd like to talk about or share that you think is valuable that we didn't cover?
I feel like we covered it all.
Yeah.
We did good.
Yeah, I think so. So hopefully it's helpful to everyone who listens to this video and hopefully people can start to figure out not just their myofunctional issues, which is usually what I talk about, but also connected gut issues and potentially maybe even SIBO issues. So yeah, thank you so much for telling us all about this stuff. I learned a ton. So why don't you just give us how can people find you? How can they look you up? And I'll link that in the video as well. But give a shout
Perfect.
out to yourself.
Well, you can find me at SIBOdiaries.com. I blog. I should be blogging more now that I'm done with school. You can also follow me on Facebook. I try to post about like once a day, but sometimes I'm not as good. So those are the two main places. So stop by. You're
Actually,
always welcome.
yeah, congratulations on finishing school too. What does the future hold for you? Are you going to be practicing functional medicine, or tell me about that, because I know that's what you're getting into as well.
Yeah, so I should be launching my own consulting practice in the summer at some point. I'm still trying to figure out all the ins and outs of like exactly how to do it. So it's just kind of a process, but hopefully by middle to end of summer, I should be up and running. So I really want to work one-on-one with clients. That's my goal. So that's exciting.
Awesome. Oh,
Yep.
that's super exciting. We'll have to do another interview or just discussion about stuff to kind of help you launch that whole platform for yourself and talk more about some of these other issues, because I'm sure you'll be doing more than just SIBO stuff. And yeah, we should stay in touch for sure.
Yeah, that'll be awesome.
All right. Well, thanks again. I guess we'll just call it good. And yeah, I guess I'll talk with you later.
Thank you, Sarah.
Thank you.